Thank, thank you very much, Marielle. I'm looking forward to our conversation. Let me just share my screen here. And boy, the direct care movement has come a long ways. Some of you I've known for quite a long time, including Dr. Clint Flanagan, who I'm going to be speaking with later. But I want to take you back. I don't know if you remember June 4th, 2010. I don't know if you know that day, but probably not. I was actually the first national writer to chronicle how direct primary care could play a critical role in transforming the US healthcare system, including a couple of years later, writing the seminal paper on direct primary care. And my piece entitled Health Insurance's Bunker Buster has been highlighted many times by the father of DPC, Garrison Bliss. And I also wrote another piece in Forbes a little later entitled This Job Could Save America, talking about the critical role that benefit advisors play and really playing in the next era of health plans, since it's super clear that the last era has failed us miserably. I mean, my first book, I wrote a chapter that America has gone to war for less than what the status quo has done to our country. So naturally, those wanting to protect the status quo want you to feel powerless against, nearly $4 trillion machine and really a disaster. However, what I want to draw out today is an example from another area of health, food, where there's also powerful, entrenched oligopolies that are being toppled by far superior offerings because of some unlikely collaboration. And I think food's a logical place to talk about. After all, Hippocrates said, let food be thy medicine. So we're going to copy into the chat the first chapter of my last book, Relocalizing Health. The future of healthcare is local, open, and independent. You can download the full book off our site, as well as get it on, your favorite bookseller sites. But the system change model that has lifted tens of millions out of poverty and is remaking the most important facet of the US food system offers us lessons and why your role is so critical. And even though it may seem like you're a small part, maybe even outside the system, as you'll see, you're not only not powerless, your local efforts can really drive national transformation. So I want to draw your eyes to this example. As we've seen at the national and kind of global level, we've had these brittle and brutal national and global supply chains that have all kinds of problems because they have these Wall Street governed kind of monoliths that really pray at the altar of scalability, that is making a singular thing massive and extractive. And I think it's really time to regain health sovereignty, as we'll talk about here. And so if you draw your eyes to this section of the book, I think it's very instructive for us. And I'll just read this section of the book. In scores of ways, Americans are figuring out how to take advantage of the opportunities of this era, often through bypassing or ignoring the dismal national conversation. There are a lot more positive narratives out there, but they're lonely and disconnected. It would make a difference to join them together as a chorus that has a melody. And that's part of what we're talking about here, is that there is a natural opportunity to sort of sing from the same songbook with advisors in your community. And in contrast, the key difference here that I want to highlight is it's about adaptability and regeneration. I live just on the other side of the hill to the left there. Because we had a resilient and adaptable food system that serves the watershed, which is most economic units are really on a watershed basis, we didn't really skip a beat. In fact, a bunch of people were able to improve their health because they had access to a far superior wheat flour, one that tastes better, is healthier, and is even fine for most gluten intolerant people, while being far better for the farmers, the environment, and their local economy that had been devastated a few decades earlier by the massive centralization of our food production system. So I think it's an interesting example that we can draw out. Let me just see if my screen will advance here. One second. Okay. Hang on, I think there's, okay. Sorry about the tech issue here. But as the book speaks to, this notion of local, open, and independent, I want to just highlight a few things about that. And I'm going to read a couple excerpts from the book. Focusing on local reveals a number of intrinsic advantages that are often overlooked in the larger picture. First, by decreasing scale, solutions can appear to problems that seem too complicated to solve at the global scale. For instance, re-engineering the food system or decreasing poverty really are intractable when viewed at the global scale. Even the basic units of those systems, people, are invisible. By dialing into local, new features and relationships emerge. And then I go on to talk about the openness. Openness is proving itself in an array of settings. The beer market is mature and has been dominated in the US by a couple behemoths, yet craft brewers recently have grabbed 24% of beer spending. How do they do that? Craft brewers are radically open and with each other regarding how to succeed, recognizing that their real competition is the mega brewers, not each other. And this leads to some unlikely collaborations. Coyotes and badgers have long been thought of as kind of separate from each other, but it's been found they actually cooperate to mutual benefit. And we see the same with those committed to transforming healthcare, even though they may be kind of different creatures, perhaps from a political standpoint. And I'm pretty confident that if MSNBC and Fox covered badgers and foxes, they'd focus on how different they were and how they had no common interests. But I want to draw out another quote from the book that probably the most influential person in my business life that really has transformed my thinking is a gentleman named Chris Brookfield. And I'm going to read a quote from him. And he was a key architect in what led tens of millions of people out of poverty, and was an investor behind what's going on in the remaking of the wheat part of our food system. It says, one indicator that a movement is ready for development in the commercial sphere is when it ceases to be perceived as political within the relevant communities. While movements remain politicized, there's insufficient agreement. When the community itself is split in its support, this method of commercial development is doomed at the outset. On the other hand, it was obvious in the case of both microcredit and local food that virtually everyone in the local communities agreed with the underlying premise. When community business models and commercial values align, they were able to attract nearly unanimous support. I think it's a powerful statement. And you can read this quote here that I had in the book. Localism realigns entrenched politics. It's striking how new alliances are formed at the local level that are impossible at the national scale, where conservatives see federalism, independence, entrepreneurism, and local business, and progressives see community building, health, nutrition, and nurturing. And so we're seeing very transformative things when this happens. And there's this concept of fractals, if any of you are math people, that's really important. In health plans, I think of fractal communities as employers, as unions. And that's where these things begin. And over time, they share common interests like ensuring proper, unconflicted primary care, drug procurement, and more. And if we go back to the food environment of a fractal community, this is in Bali, basically rice farmers. You see a similar thing happen where they're owned by many different people, where fractal planting patterns yield optimal harvests without any kind of actual central control. It's really striking when it's architected this way. You see this again in the craft brewing environment independent craft brewers collaborate in a number of ways, including sound business practices, packaging of their products together, sharing distributors and product inputs. Does that sound familiar to you? I think a lot of the rest of the summit's going to be like that. So I think it's particularly striking. You have here Kevin Morse. He runs the mill that serves the community, my community, but he's one of dozens around the country that have open sourced their production methods. What's held proprietary is the individual local relationships. Those can't be copied by the behemoths. In the process, their marketing and distribution costs are dramatically lower, and that helps offset the somewhat higher production costs of this higher quality product that they create. The result is amazing, right? The product is beautiful, the environment's beautiful, it's healthy, it's tasty, and it's really reinvigorated the local community. And another example of fractals is flowers. And we see throughout our natural system this kind of replication of fractals that reaches very large scale, from water drops to river systems, from leaves to trees. You see this expansion of fractals, and we think that same opportunity exists here. And so if we bring it back to kind of the realm of healthcare and health plans, I'm going to draw an experience that Bryce Heinbaugh, one of the Health Rosetta advisors, and I'd preface this with, candidly, I see a lot of benefits advisors and DPC practices being pretty scattershot, or what I like to call kind of spray and pray. In contrast, those having the success like Bryce, like Clint Flanagan, they start modestly, but they have an eye towards replicability and growth. Bryce is also very deft about speaking to business leaders about the importance of clinical efficacy. I mean, he's not a clinician, but when you have a scenario like his, and this is really true in a lot of the country, he's in Ohio, where the opioid crisis has really impacted businesses. If we're honest about it, I wrote an entire book looking at the healthcare system through the prism of the opioid crisis. It's a self-inflicted wound by our healthcare system, by the status quo. And the nice thing is, when you get it right, like what Bryce is doing, what you're all doing, a natural byproduct is you're going to spend 20% or more less. As I often say, the best way to slash healthcare costs is to improve benefits and improve care. And you can see here the kind of growth. Again, it started very modestly. 3-4 years ago, Bryce was just getting started. He was like many of the benefits advisors that are in the Health Rosetta community that are earlier in the journey. They're at a pretty modest level. Essentially, a stage zero, what we call a community-owned health plan, starts with a singular employer. And then, as you see, Bryce went all in, and it grew, and it's grown. And I think the worst year he's had is 40% year-over-year growth, and it continues to grow. And as you see with this quote, social proof is a real game changer. He's had this nice growth that continues this year. And as you see what's lined up next year, it looks very promising that he'll probably more than triple in size, because he's put in the right sort of framework and the right kind of growth pattern. And so I think that's one that leads to a nice segue to, I want to bring on my friend, Clint Flanagan. He's the founder, I think many of you know, and CEO of NextEra Healthcare. He's been involved in these kinds of collaborations. And we have a bunch of questions that we ask when we're looking at whether a community is ready for transformation. And so I'm going to draw on some of these questions with Clint, kind of draw out how it's worked in his community and how can we all learn from that. So first of all, welcome, Clint. Great to chat with you again. Hopefully it'll be face-to-face before too long. But really, I think your story is extremely relevant to the community here. So maybe we'll just start. We have not only the direct care community that's been a part of the HINT summits, but we've got the Health Rosetta advisors. I think we have about 100, at least right now, on with us. So let's start a little bit about that collaboration. Do you have strong relationships with any advisors in your community, as well as some of the other complementary organizations like TPAs? Can you give us a little bit of a handle on that?
Yes is the short answer, Dave, and happy to dive into detail there. Before I go too far there, though, I just want to thank Hint and Mariel, and it's really fun to be on the stage with you, Dave. I remember the Bunker Buster article that you wrote, and I'll tell you, boy, we were pretty thrilled at the time because there were only a few of us in the country, and to have an article like that came out was tremendously helpful to many of us who were in the startup phase. And I also appreciate what you're saying about local. We've been huge fans of that out here in Colorado, whether it's local craft beer or local cattle or local co-ops that provide vegetables and fruits to our families. Huge fans of that. So I love the parallels. And unfortunately, you have me thinking of craft beer, which might derail this whole conversation. But when it comes to benefits advisors, brokers, those in that arena, they're tremendously important for us at NextEra Healthcare on many fronts. Understanding that over 80% of our members come from employers. Oftentimes, those employers have a benefits advisor broker, right? And back 10 years ago, when no one really knew about direct primary care, we had to kind of weave our way through that, let's say, sector to try to figure out how can we talk to our employer friends. Now, granted, a lot of small businesses, sub 50 employees, have no health benefit plan, none. So that was a natural target for us, and still to this day is a natural target, to be able to talk to the owner of a plumbing company or the owner of an HVAC company or a restaurant owner. Here in Colorado, to pay for a typical BUCA plan is maybe $600 to $1,000 per employee per month. And when you look at what the cost is for direct primary care and all that we can offer, it's almost a pretty simple fit for these owners to write a check for their employees to have direct primary care. As we continue to evolve, and I appreciate your comment, Dave, about sometimes you just start small, right? Like we had a few clinics here in the Boulder-Weld County area in Colorado back in 2009. Now we have nearly 80 clinics this year that are in our NextEra Healthcare community. As we started small and continued to grow, it was really important that we develop strategic relationships. And whether that was with benefits advisor brokers, whether that was with chambers of commerce, whether that was with HR groups like SHRM and presenting at SHRM groups, we kind of weaved our way through saying, who can we connect with and just tell our story.
Yeah, great. Well, speaking of employers, one of the things that we found that's very pivotal in a local market, the quote I had there from Bryce, as other employers see somebody in their community doing something, and it's an organization they respect, it's a huge driver. But the key question, I guess, is have you found kind of potential, what we'd call kind of anchor employers? I mean, think about, malls that have anchor tenants that are excited about being a leader or reference or willing to talk with other employers. What's kind of been your experience on that, and to the extent it's existed, what influence that's had in the community?
Yeah, I'll give you at least one example there. So we take care of municipalities. So, you can imagine a town that has firefighters, policemen, HR, public works department, et cetera. And in this one particular case, one of the towns that we take care of is right next to another town. And in short, the policemen from this particular town talked to the policemen of the other town. And as much as we had been talking to, let's say, that town's leadership and HR that did not have NextEra, I think at the end of the day, it was the policemen that made it happen, because essentially the policemen were pretty stoked about their direct primary care benefit. and the town right next door didn't have it. So they were very influential and pretty much mavens for us as it came to bringing that other town on. And now technically there are 3 towns pretty close to each other, and we have people from the municipalities in all 3 towns that have direct primary care. The other one that I'll think about or talk about quickly is just a company we take care of that's a Fortune 500 satellite company that here just a few days ago launched a few more satellites up into space. And if you have Sirius XM, if you use Google, if you use any kind of mapping or software along those lines, this company is probably the company that's doing that. But the short is their leadership wasn't necessarily looking to save money. Their leadership was saying, what can we do on top of our existing PPO plan that's self-funded to provide better benefit to our employees so they can have better access to primary care? What can we do to perhaps have an on-site clinic, which they had at least 1,000 employees in one site and had no on-site clinic. And fortunately, there were a couple of employees that were already paying for their NextEra direct primary care benefit. And in this case, those employees were instrumental and mavens for us as that company brought NextEra on, and that now is going back, I think, around 5 or 6 years. So yeah, those stories and relationships, whether it's a policeman telling another policeman or an employee telling their leadership, are tremendously important. So find those mavens for your direct primary care.
Yeah, and I'm reminded of a scenario with a city in my area, city of Kirkland, where they had, last I heard, 6 of the 7 unions were on board. And unions are an interesting one because often labor and management are opposite sides of the table, and until there's this light bulb moment that happens where they realize, actually, we basically want the same thing. Our foe, if you will, is the status quo healthcare system. And at a certain point, I have a case study in my books about the school district or it's actually a consortium of school districts around the Pittsburgh area. And it quickly changes to from management to labor, really pushing for these changes when they realize how much better it can be. And it's, at the end of the day, there's pretty much a fixed pot of money that can go towards benefits and wages. So that's another area that they can be very influential. If we pull back, you obviously have the police officers you mentioned, but curious, at the community level, have there been key civic or business or even faith-based leaders that have had any influence in sort of spreading the word?
Yes, all of those that you mentioned right there, as I think about community organizations, we've had a lot of success with the Chamber of Commerce's. We belong to at least a couple of them in the towns that we're in. We host events, we speak at luncheons. We, in fact, I think are getting ready to do an event here Q1 of next year, and we're actually going to have it's sponsored by us, probably a few other doctor groups that are specialty groups, as well as Sedera is going to come up, I believe. And they might know that, they now know that for sure. It's not in the calendar, but I guess I'm live saying it now. But the point is you bring a number of different solutions together, right? And that's what happens when it comes to small business and communities, as you've mentioned, Dave, right? Is that you want to take those that are involved in the community, whether it's a chamber or church. We take care of churches. We're hopefully getting ready to bring on another group in Boulder that has about 25 in their leadership at the church. And those can be really, really great places to help expand your business. And I think that's the common thread there, right? Like I look at, we take care of a craft beer company and how influential they've been in talking to other companies, including small businesses like restaurants in the Boulder and Weld County area. So, essentially in the eyes of these employers and maybe even the benefits advisor broker, DPC is still a little bit new. In one of the ways that we introduce it is, A, are you happy with your benefits or healthcare? And B, are you happy with your spend? And we've been asking that question for a lot of years. And essentially the answer most of the time is no and no. we're not happy, we're spending a lot of money, and it takes me a month to get in to see my primary care doctor. And no, I can't text him. No, I can't email him. I don't really have a relationship with my primary care doctor, right? Like, so those are all opportunities. We really try to understand the pain points and say, hey, how can we do better to help you out here?
Great, thanks. Hey, we're going to go into Q&A from the community. So if you have questions, please put them in the chat box. I wanted to, so certainly Clint and I could probably speak for a couple hours here, but want to make sure the community has. One thing I'd add also on the influential piece, putting a postscript on the Bryce Heinbach story in Northeast Ohio. This is a, kind of, I guess what would be called a Rust Belt, community that's been pretty hard hit over the last, few decades. And they, I believe for the first time in 21 years, their school levy didn't pass because they're having pretty tough economic times. And it's a small district, but it was a $2 million levy. Happily, because Bryce had put in a plan that had direct primary care, had the rest of the things in the Health Rosetta blueprint, they had saved last year $2.2 million. So instead of having to cut teachers, cut programs, all that kind of thing, cut benefits, pay, they're able to continue to move along. So that's the type of thing that really does spread the word when people see that. But if you pull back from that, they learned about this approach because a private sector employer had done it. So there can be a nice virtuous cycle there. So Mario, if you have any questions, let us know, and just interrupt. But I do have another question if we don't have any from the community yet. Here we go. Here's a question. So does Nextera have a dedicated sales associate? And who is it that's doing the reach out? Is there a lot of cold calling? How is this done?
Yes, is the answer to that. And it's not just one. So we have a whole business development team. That's a lot of work, right? We all know as DPC physicians how awesome DPC is, but it's important to get out there and have a sales and marketing lane that can help on that front. And that, even if you do hire, let's say a sales marketing biz dev person, sometimes some of the best people that can talk about what you do is you, the physician, right? And so that happens every day. And that's something, as doctors, sometimes people say, hey, we're not salesmen or we're not comfortable in doing that. I would encourage everybody to get real comfortable in doing that. And if you're, encouraging a person to take a Z-Pack for their medical concerns, you're essentially kind of selling there, So we all do a bit of that. And it's important to get that message out. So whether you're a company of 1 or 2 or a company of 30, really important to be talking about the benefits that direct primary care can provide, and who better to talk about that than you. So if you do get to a point where there is a employer coming on board, really, if you can, make sure and go to the open enrollment meeting. Don't ever let the benefits advisor broker talk about what you do, right? Like, you be there. We found that to be tremendously important, and we still do that today. Although some of these open enrollment meetings are virtual because of COVID, we're very much looking forward to getting back to where they're face-to-face.
Yeah, that's great. And I believe the root of the word doctor is teacher. And that's one of the things that, a lot of folks aren't comfortable in sales, but the best sales method I've seen, certainly Bryce has done that, I've seen a lot of docs do this, is education, right? You educate on what's out there, the category, the solutions, ask the sort of questions Clint mentioned. And, I sometimes will needle my physician friends that they're squandering their hard-earned credibility and trust in the community. Doctors are the second most trusted profession in America after nurses. And pretty much every doctor I know has neighbors, they have people they go to church with, they have, kids that, are in sports with, the kid of another, business owner, whatever it might be, patients, of course. It's just educate, right? But okay, we have another question from Rhonda McGrew. Have pediatric DPC practices been successful partnering with employers or businesses, or has this success been more of a family practice clinic. So I think we're down to the last minute here, so maybe we'll wrap up with this, and perhaps Clint, you have perspective on this.
Yeah, I would say that any primary care business, even specialty business, can be successful in direct care. I look at our doctors across our span. We're all internal medicine doctors, family medicine doctors, and then we have some meds peds docs. So if you're a pediatrician, definitely your services are valuable. That being said, a lot of families want to have a place to go. So maybe you take a look in your community to see if there is a primary care doctor or internists, specifically an internist maybe, and maybe there's some synergy there between the two of you. But the short answer is yes, I'd be happy to go offline here. I think with the Hop-In platform, you can connect to us directly, and would be happy to further discuss that with you.
Great. Yeah, and that's a good reminder. You can connect with us, connect with each other. Hop-In is a very powerful platform to make it easy to allow people to connect. The speed networking feature is a great capability. There's booths that the sponsors have, and there's educational materials there. And of course, there's a lot of sessions that are great throughout the rest of the day. So I want to thank Mariel again for introducing us. Thank Kent for having us. And thank all of you for making a huge difference in your communities.
Thanks, everybody.